A typical treatment for TMJ, tinnitus, even just facial tension and pain, I wanted to show you we use our hands a lot to help our patients' necks move equally right and left on each segment. So here I'm testing C2, C3, the second vertebra and the third vertebra joint. I'm feeling the base of her skull to see if there's any tension. She has tension on the left side. I'm going to go down and just kind of test the joints right and left to see if there's any asymmetry. She's got a little stiffness at this level, which is about C4, C5 on the right. And it's just giving me an idea of where I'm going to focus my treatment. Her right side is much more stiff than the left. So what I want to do is also I'm going to bring her forward. I'm going to rotate her. Can you mark where your chin is on that side? And we're going to rotate her left. And go ahead and put your finger there. And now if I look at Miranda, I put a finger of a hand right in the middle. She's moving much more to the left than the right. So we have to work on that upper cervical spine to even it out. The upper cervical spine will affect the TMJ position quite a bit. So I want you to know that we're going to work now on maintaining a good upper cervical spine symmetry, and then we're going to work in her mouth. So here, just going to give her a little bit of treatment. And earlier, I tested if she was hitting harder, and you were hitting harder on the left side of occlusion. So we're going to see if we can work on getting her upper cervical spine to be neutral. Here I'm doing a little distraction, so I'm pulling her head back towards me, separating each joint. I'm going to put a pair of gloves on. These gloves will help me be able to go inside the mouth of each patient. Here I am. I will go onto the muscles of the face. I want to feel for trigger points. Trigger points are these little bands in the muscle. So she's got some on both sides actually, and they feel like little speed bumps. These speed bumps will cause some pain, and they normally come from clenching. So I'm also going to try to see how far I can go behind the mandible, see if I can palpate this sternocleidomastoid muscle. This muscle tends to be one of the muscles for tinnitus that really affects the ears. So we might use dry needling, we might use our hands, but we want to soften all these muscles so they are nice and relaxed, so that you have a nice relaxed head and neck muscle tone. Now I'm going to place one thumb inside her mouth. Go ahead and open. And I'm just going to palpate her cheeks. Her masseter muscle is a very important muscle to palpate. The deep masseter refers to the ear. It also refers to this area. But if it's tender, raise your hand if it's tender, Miranda. Yep. Okay. There's another muscle I check, the lateral pterygoid. I'm going to check it here. Raise your hand if it hurts. Okay. Not so bad. And then you test the other side. I'm going to go in and now check her joint mobility. So the joint mobility of the jaw, place my right hand on the left side of her back molars. Turn your head a little bit to the right. Now relax your jaw. Here's her joint. I'm pointing to it right here. Relax your jaw. And I'm going to ask you to just gently open with me. 1, 2, 3, open. So I'm feeling, relax, 1, 2, 3, open. How well this joint separates from the skull. 1, 2, 3, open. So if you have locked jaw, if you have a lot of clenching, 1, 2, 3, open, you will have restricted range of motion in that mouth. Maybe one side more than the other, depending on if you have any clicking or popping. But the goal is to really balance the upper neck, to work on the position of the mandible, make sure that We work and train tongue posture so it supports the position of the jawbone and the support of the airway, so you stay with a nice patent airway while you breathe at night and during the day. And we try to give enough space around the joint of the TMJ for any clicking or popping so that you have a little wiggle room so that that disc can accommodate itself better. And this is just a mini description of what you might expect on your first day of treatment.